Hello, today I'm going to introduce you to Dr. Taruna Madan. She's a very, very well known scientist who works with the government of India, and she's an immunologist, and she has a scientific perspective on autoimmune conditions, which she is going to share with us right now. Thank you so much, Dr. Taruna, for joining us and helping us understand what goes on inside us and helping patients with their disease.
First of all, thank you, Rachna, for giving me this opportunity to be a part of this autoimmune masterclass. Definitely a dream for us, so that we can, help other people and share the knowledge that we have generated over the years. And I would like to say hello to all my complementary medicine healers, most of all and closest to my heart, autoimmune warriors. And I feel so happy to be able to address you and would have loved to be here live with each one of you, because I'm also partner, spouse of someone with an autoimmune condition. As an immunologist, I understand what's going on in this body and in his mind, and yet there are times that I feel helpless. Each one of us who has been a warrior or a caregiver to a warrior has experienced this. I would like to provide my scientific perspective as a scientist and immunologist over here to help you understand what we are dealing with. Yes, the immune system is constantly being challenged. The pathogens, antibiotics, compromised gut, other causes are being increasingly linked to autoimmune conditions. But the most important link that I have seen is the link of stress. Stress increases your inflammation. Under normal circumstances, inflammation is good for us, as inflammation has several important roles. For example, tissue repair, angiogenesis or formation of new blood vessels. But when it becomes chronic, that means it is repetitive, the immune cells are fatigued, tired, are unable to perform functions in a wise manner, very similar to our behavior under stress. Let us not negate this link, which is like a burden every minute on our shoulders. It was a stone. Whether we are away in sleep, it remains in our subconscious and it continuously fuels pain, stiffness, skin issues, or damaging parts of the body attacked by our own immune system. But when we actively start reducing inflammation with physical and emotional nutrition, there is a scientifically measurable outcome. This scientific output shows the ability of the human body and mind to repair itself by just eating right and reducing stress levels. Unfortunately, for autoimmune conditions, eating right as normal, healthy people doesn't work, which is why the pillars listed in this autoimmune masterclass are important for you to understand in order to help yourselves for those you are looking after. So let us work with not only nourishing ourselves with what is on our plate and what is inside our medicine cabinet in terms of our medicines, supplements, but also nourish our minds and souls so that we can reduce the flare-ups and pain. I'm sitting here with Sanjeev, Dr. Sanjeev Gupta, my spouse, who has been fighting the world with his psoriasis because there were people who were unwilling to accept even shaking his hand because of his skin. This is clear discrimination against autoimmune warriors who are not just struggling with the debilitating physical and emotional effects of the disease and toxic medications like methotrexate, of which Rachna has already shared the severe side effects of, but also the emotional trauma that patients go through on a daily basis when they are amidst ignorance. What are autoimmune conditions? You've already understood this. What does medical science do? You've already understood that it doesn't offer cure, except for management and control for a specific amount of time, beyond which the drugs don't work. Controlling your inflammation levels, controlling your reaction to stress, controlling your antibodies is the key. How can that be achieved? It all gets achieved by changing our response to stress. This response to stress is clinically proven to either lengthen or shorten telomeres in people. Now, what are telomeres? These are, segments of the chromosomes at the end of our DNA, which actually gets shortened with aging, and they actually lengthen with a good lifestyle. Nutritionally superior lifestyle has clinically been shown to lengthen telomeres, which means, in simple language, we can repair our DNA. Since autoimmune conditions are all governed by the background of a gene present, this is the first stage of helping control this response. The steps in this program of the Autoimmune Masterclass are specific and need consistent following of the advised physical and emotional nutrition that changes the response of the genes toward the disease. And this is called epigenetics. And this is what works in holistic nutrition to reverse many autoimmune diseases. So, what you eat is definitely important, but it is only 25% of the story. What you eat, how you respond to those thoughts, what are the thoughts that you put in your mind, they are all equally important. Holistic treatment has clinically proven to show epigenetic changes in the body and to reduce disease activity. This class only focuses on epigenetic changes and what is proven by science. My husband is currently getting tapered off on his methotrexate. And I think he's a wonderful inspirational example for each one of you to follow. And a special thanks to Rachna for this. Use the knowledge and learnings from this class to benefit yourself or those you care for, or even at a larger platform, help patients and families struggling with autoimmune conditions. If I, as a scientist, felt helpless about my husband's psoriasis, imagine how many families are out there that need your help in implementing this knowledge to reduce suffering and make a better life for autoimmune patients. Each one of them deserves a fulfilling life. Since this masterclass is also certification based, you can utilize this to formally practice and consult and counsel the autoimmune patients. Let each one of us go and spread the word. This is the message from Rachna. Thank you.
Thank you so much. This is so wonderful, and you put it so beautifully. I'd also like to request you. There are some doctors in our autoimmune masterclass, and doctors out there who are struggling with the side effects for their patients, but are unable to help them because right now the research on autoimmune conditions is not really complete. Can you please give a message to them on the basis of your experience as an immunologist, as well as seeing Dr. Sanjeev struggle and adapt to the nutritional healing? He's halfway through his journey, so please do send a message for the doctors out there.
Absolutely. So, uh, dear friends, what I want to suggest you is that drugs are definitely there to help us cure or manage some of these conditions when they become acute. But definitely tapering off the drugs is an important part of the medicine that has been ignored for several decades now. So the important thing is we should have programs as we have protocols to start a medication for a patient, we should have protocols to taper off the medication also when the patient is showing remissions. So these protocols have to be defined properly, and definitely they would require clinical trial backups, the way the trials are there for the drugs. And another important thing, I would like you to advise your patients, because when Sanjeev started taking methotrexate, we hardly suffered the side effects that are caused by methotrexate, because Rachna had already strengthened his nutrition by giving him supplements which were as per his blood reports. She had evaluated what nutrition he needs, and that's how she advised us to take that. And before starting methotrexate, for few months we were on that special diet and nutrition that helped Sanjeev to start methotrexate therapy without any side effects. Though we are not completely out of the side effects, for example, the fatigue, the lethargy, every day morning Sanjeev gets up with that lethargy and he feels that he won't be able to even go for a walk. And then, as Rachna prescribed, one green tea cup and some almonds, and he's all up and ready to go. And that makes so much of change for me. If my partner is lying down and not feeling well, you can imagine what kind of a life I will have. Though I understand all the immunology and all the science and all the medicine, but what I can do, so I can only follow what Rachna advises, because she understands the science of nutrition better. And I feel that you can also advise your patients to consult for nutrition, so that they can your advise drugs, and nutritionists advise nutrition, go hand in hand, and help the patients lead much better lives.
Thank you, Dr. Taruna. So well put, and I completely agree with you. The purpose here is very single minded. Whether the autoimmune patient is on medication or not on medication, but their quality of life and longevity is what matters. So, even if they need to continue with certain medications which cause side effects, not only reducing the side effects but also reducing things like brain fog and chronic fatigue become important, and that is where holistic nutrition plays a role. I have been fighting, actually, a lot of people come to me and say you are going to ask us to stop the drug, and I keep saying no, I am not going to ask you to stop the drug. I am saying that there is an ecosystem that you have come to me in with a poor quality of life. Let us just focus on the best that you can be under these circumstances. And that is all, the focus is there. And after that, like you said, let us follow a scientific protocol for tapering off. When the human body does not need any drug, then symptomatically and reports as a combination are a good indication. And I have seen rheumatologists and doctors tapering off medications after a few months of following the autoimmune nutrition themselves, without any conversation either with somebody like me or even with the patient, because they recognize this scientific improvement.
Absolutely.
Yeah,
Absolutely.
yeah,
And
great.
that, that's combination of nutrition and medicine actually offers you a complete cure from the ailment. The medicine alone will not be able to help you.
Yes, I completely understand, because it's an unpredictable disease, and because you have to constantly be on top of the nutrition to be able to stop the pain, flare ups, chronic fatigue. Sometimes for working professionals, it becomes very difficult to taper off all drugs,
Absolutely.
unless if we live in the mountains with pollution free air and organic food and no stress, which none of us do. So some amount of supportive medication is absolutely fine, as long as your quality of life is great, your organs are protected, and there is longevity.
Absolutely. Absolutely. I agree with you.
Yeah.
And thank you once again for giving me this opportunity.
No, no, thank you. I know you are on a very important task to save lives for all of us. So I wish you all the best in this journey. And as always, you are going to be successful in everything that you do. So looking forward to seeing you back in Bombay soon.
Sure, sure. Okay, Rachna.
Thank you. Bye.